Meeting is intended to be informational to convey what public health understands the waiver process to be, the data that we have today, where we think we're trending, and how that may affect the waiver possibility. And I'm going to hand it over to Dr. Doohan, who will give an introduction, and then we can follow up with questions. If you'd like, you're welcome to use the chat, and I'll try to pass along the questions to her. But I think we have a small enough group that we can also unmute and take turns.
Thank you, everybody. Good morning. I am still in the role of health officer. I think you've probably heard the news that Dr. Andy Corin, who's a highly regarded and trusted family doctor who's been in the community for decades, is retiring from his practice with Adventist Health and coming on as health officer. And I'm very, very grateful for this because he and I have a close working relationship for the last 5 years. When I was starting the residency program, the family medicine residency program for Adventist Health. So the process is going to be that I am still the health officer and will continue to be the health officer until Dr. Corin is sworn in. But even at that point, I will still remain, I'm been hired to be on contract to support the new health officer, and I will continue in that role. So I'm going to work closely with Dr. Corin. So there will be a seamless transition, and I'll continue to be working, supporting him and in my capacity till January 1st. But as of now, and I anticipate for the next month until the end of August, I'll continue to be in the role of the health officer, and there can only be one in every county by statute. So this situation with our schooling for our children has been very difficult. And I want to acknowledge that communication from the state has been difficult. It's been confusing who is calling the shots with schools. Is it the governor? Is it the health officer? Who's closing schools? And this has been an issue for health officers across the state of California. But the reality for the health officers is that we've been waiting for the governor and following the governor. I don't know of any health officer who has done anything more restrictive than the governor. We've been waiting for the governor to make decisions and then following the governor's decisions across the board. What's happened last week, which was what the health officers were waiting for, was a decisive move on the part of the governor. When the governor releases a guidance, it's actually an order. So while the language says it's a guidance, it is an order and should be interpreted in that way. So last week, the governor put out a guidance, which is an order, that essentially, if you want to boil it down, it says that if a county is on the watch list, and I'll talk about that in a moment, then they need to go to distance learning unless a waiver is granted. And if you read, there's a footnote, which I think this has led to some confusion. There's a footnote in that guidance that specifies how that waiver process would take place. It requires the school superintendent or leader, in the case of other school structures, it might not be the superintendent, it might be the principal. You know, you would all know for your individual schools. It requires the leader of the school, together with the community, the parents, and labor, to come forward to say, we want a waiver for this school. So the language in the order from the governor, which he calls a guidance, is that there must be collaboration with the community, parents, and labor. But the health officers are going to be looking for some documentation, some sort of proof, if you will, that there was a consensus statement or agreement on the part of community, parents, and labor that school should be given a waiver. Then that request will come to the health officer, and the health officer takes that request to the California Department of Public Health. California Department of Public Health then will respond. So this is the health officer is an intermediary in the request for a waiver that would be granted from the state. And this is spelled out in the guidance document from the governor that came out last week. For the health officers, we did not know that the governor was going to tie this to the watch list. So we didn't know, I didn't know, and I'm not aware of other health officers knowing that was going to be the direction that this went, but it is. So the watch list has also been something that has evolved over the last month from the governor. And again, the health officers learn about these changes. I mean, it's not at the same time as the public, because we usually have like a couple of days ahead of time to get a hint, but we don't know exactly what the governor is going to do until he gives his press conference and then he releases the guidance. So the watch list also was something that was new about several weeks ago. And before that was attestation. And this is where there's been a lot of confusion. If you remember, it was maybe 6 weeks ago, we had to go through this attestation process. That occurred very quickly. And attestation was to allow Mendocino County to become a variance county. And that was at the point of time of that attestation, we had to say, here are indicators that we have good control over COVID at this time in our county. And that allowed us to open some sectors of the business community in particular, open them up earlier than other counties that were non-variance counties. So that's why some of our sheltering in place orders got loosened. And this happened across the state in non-variance counties. Then after the attestation process came the watch list process. The watch list process is whereby the state receives data from the counties and they look at this data and then they indicate whether there's the impression that that county is getting into trouble with a surge situation. So if you do go on the California Department of Public Health website, you can look up the watch list and you can see the metrics by which the counties are being measured and by which they're put on the watch list. So the metric that we should focus on today is if a county has 100 new cases per 100,000 people in 14 days or more, so that's 100 new cases per 100,000 people in 14 days, they automatically go on the watch list. So we are there. I'm telling you, in Mendocino County, we are above the 100 new cases per 100,000 people in 14 days. The issue is that there's a data lag between when we see this data, and I can tell you we're seeing it because every day I'm told the number of cases and it's 10, on average 10, and it's going up. So we're starting to see it trending up. I know that has been coming in. And so in the last 14 days, we have averaged 10 cases a day. So that would be 140 cases in 14 days. That's well beyond what is the thresholds for entering the watch list. But the state, who I've been calling and on the phone with as early as last night, is not seeing that data hit their system yet. And that's why we are officially not on the watch list. But I can guarantee you we will be, because our numbers are not going down. They're staying steady at 10 a day. And in fact, they're creeping up. So we will be on the watch list. The state knows it, but officially, if you look on statewide websites, you won't see that we are yet. Regarding where we're at with COVID, we're seeing every indicator that a county sees when they're starting to surge up. We see outbreaks in nursing homes, and we have tragically an outbreak at Sherwood Oaks on Fort Bragg. We see outbreaks in grocery stores, and we've had our first outbreak in the co-op in Ukiah. An outbreak is defined as 3 or more cases. A cluster is 2 or more cases. So in the co-op, we had 3 cases. We also start to see outbreaks that are very concerning in terms of large gatherings, and we've been seeing those as well. So this is what was seen in Sonoma, this is what was seen in Marin, and then we start to see an increase in hospitalizations, which we are seeing as well. We're averaging about 8 hospitalizations at any one time, spread across the 3 hospitals. And we have some of those patients being in the ICU. And we've now had 4 deaths in Mendocino County. The first one was a gentleman where, we did report this with the family's permission, was admitted to the Adventist Hospital, discharged to a skilled nursing facility in Marin. And so he actually died somewhat distant from the point when he developed COVID. But last weekend we had 2 cases from Sherwood Oaks die. So these were, frail elderly people in a skilled nursing facility. And then we had a death in the last several days from Howard Memorial Hospital of a gentleman who was not from a skilled nursing facility.
Yes.
So if you could mute,
All those.
if you're not speaking, if you could mute. Are all the indications? Am I muted? Can you hear me? I'm unmuted. We now have every indication that is seen in a county where the surge is starting to pick up. We're seeing a doubling time of our cases, a doubling time meaning that you go from 2 cases every 14 days, a day for 14 days, to 4 cases every day for 14 days. Now we're at 10. We're seeing a doubling time of about 14 days. So if that holds, we would be expecting to see 20 new cases a day as we get towards the end of August, with about 10% hospitalized, and then it accumulates, right? So we're in the early part of this surge, but the way that the data is looking, the modeling is being validated by what we're seeing. We should be seeing it really escalating around the fall. So I gave I put out a press release on, I'm looking for that. It was a couple of weeks ago, on July 15th. And I put out a press release on July 15th because I was seeing on the ground, on the front lines, very alarming data, including that we had the nursing home outbreak, and including what we were seeing at the co-op and other indicators that led me to know that we were going to be on the watch list. And that was at the same time exactly that the governor was coming out with tying opening of schools to the watch list. And so that's when I came out with the press release where I made the statement. And if you look it up on our website, you'll see it, that the safest, it is my opinion, this is the quote, that it is not safe to open schools for normal operations in the fall. The safest direction to take for our children is to plan for distance learning in the fall. If the schools decide to pursue a hybrid model which complies with state guidance on school reopening, I will do everything in my power to support this school planning. So at the same time that I've been working locally here to support our public's health, I've been working with an organization that it was formed by the health officers in Northern California called Rancho, the Rural Association of Northern California Health Officers. We came together and started having regular meetings, and we had a focus group that we worked together to create a guidance document, a consensus statement between these rural health officers from Northern California that we can take to the governor to say, this is what we recommend for schools that do open during COVID. And I did share that with the last meeting of this group, this guidance document that we're working to create a consensus statement. And it is a work in progress because we're trying to get all of the Rancho health officers to agree on one document. And we all have different, environments in our rural communities. In particular, in Mendocino County, I have a masking order for the public. Well, not all of the rural counties do. And this can be very, very controversial for health officers. Again, I have it, but not all do. So there's been controversy about when to require masking in schools, but the governor has made clear statements about that. And again, the health officer locally can only be more restrictive, not less restrictive than the governor. So I want to clarify what is the role of this guidance document or consensus document by Rancho. The role of this is to help us get perhaps realistic situations in Mendocino County that we could actually have schooling. For example, in the document, it talks about not having temperature screening of children as they come into school, of every child. And I think that it may have been the advocacy of Rancho that had the governor remove the requirement for temperature screening every child as they came to school. And I got that feedback from the schools telling me it's not practical, we can't do this. Another example of what's in our guide, I can't temperature screen every child, it's too difficult as they come in, right? The other thing that we put in our guidance document has to do with allowing 2 children to a school bus seat, because it wouldn't be practical to have all the children on a school bus, 6 feet apart. We wouldn't be able to get enough children on the bus. So these are the types of things that we put in this consensus document. Again, we have not gotten approval from the governor for it, but we continue to advocate for it to be accepted. And it's very helpful to have this group of educators that can help us make sure that what we're taking up to the level of the state reflects the local and rural needs. Another issue that I want to share is that in my sheltering in place order, there are these child care stable bubbles that I created. And when I created them, the intention was with the hope that we would go to in-person schooling and we might be able to use these as a structure to allow in-person schooling. And the governor did look at my bubbles, and I got calls on the weekend from the state that they were concerned about them, but I was able to keep them in my order by calling them not social bubbles, but stable bubbles, by emphasizing that these childcare bubbles are meant to be a stable group of 12 for 4 weeks minimum, and that within these bubbles, you don't have social distancing. So that was to take into account that young children, it would be nearly impossible to get them to not be close to one another. And so that childcare bubbles stands. The stable bubbles are in my orders. The state has not required me to remove that. And in addition, the guidance that the Rancho health officers has moved up to the state talks about a spectrum of interactions in the classroom, where if you have younger children, the requirement for social distancing and wearing facial coverings is less, and then you focus on cohorting, like the childcare bubbles. And then as you have older children, the emphasis on social distancing and facial coverings is more. So there's like a spectrum depending on age. And in fact, the data is showing us that there are protections in the younger children against transmission of COVID. And that's why I believe that you see in the governor's guidance that there is the possibility for the waiver functioning for elementary schools. So cohorting remains a very important approach to the pandemic. What we're finding as we get into these more difficult areas of the pandemic, where we're seeing increasingly outbreaks, is that to the degree that we can define a group and say that these individuals only interacted with a small number of people, we can contain that outbreak. But when you have multiple overlapping interactions, it becomes impossible. So when you think about reopening the schools, which we will do, at some day they will reopen, at any point when they reopen, it's going to be a process. And to the extent that the groups reopen in a cohorted fashion, this is going to be the most protective. So if you can say in your school, in the ideal setting, we have classrooms and these classrooms don't mix with other classrooms, then when one child got sick in that classroom, you could put that classroom in quarantine instead of having to quarantine the entire school. That's where the cohorting becomes so important. So for the smaller schools, that is more realistic and achievable. And that's what I think will be seen in a very favorable light by the governor, by the state, when we take these waivers up to the level of the state. So we do have Neil Davis. I don't know if he's on this call, but I've asked for him to be the point person on the public health department to receive documentation and to receive information that will go towards the reopening plans and the waiver process. So he is our point person. He was on the last call with the schools. But what I would like to propose is that for those schools who do want to go through the waiver process, and I'm so grateful Supervisors Jurdy and Williams are on this call, that we start that immediately, that process of attempting to put together these waivers. We don't know on the part of the local health officers what it's going to involve, because the final step is sending it to the state. And what I've been hearing from the other health officers is that what they're seeing is that small private schools are the ones that are already putting together the waivers. But in rural communities, it could be small public schools that just are in more remote communities. But I think we don't know what the state's going to come back to us with, but we should try. And for those who want to, and I would say that this Rancho guidance that the health officers from the north have been putting together with me will help give some framework of what probably will be acceptable by the governor, because we have been sending this guidance up the chain and we haven't heard no. So usually we hear a hard no when pretty quickly with these types of things. And also to point out that the governor's guidance does spell out quite a lot about what will be acceptable and allowed for schools reopening. So I think, Supervisor Williams, that would be it for my opening statements, but I'd hand it back to you.
As a reminder to everyone, the meeting is being recorded. I'm not sure how we will distribute, but I imagine some schools aren't present. So just as you speak, keep that in mind. There are a few questions in chat. Are schools allowed to have small stable groups on campus if the county is on the state watch list? Is a waiver required today, or is it possible to have the small stable groups on campus?
Because we're not on the watch list today, we're not on the watch list officially today. So as of today, we're not on the watch list. So I guess we could try and utilize that loophole where it states that, let's see, I have to read the guidance, but once you go on the watch list, then you have to close. So you'd have to think about when that might happen. So when I spoke to Dr. Pond last night, I asked her, I was like, here's what our data that we're seeing, but you're not seeing at the level of the state. When do you think you'll be seeing the data that we're seeing? And she couldn't give me an answer. So I couldn't tell you at what day I'm going to get the call that's saying we're on the watch list. But until we are, the answer, Supervisor Williams, would be yes. You can be on campus according to what the governor has said is allowed in his school guidance.
Once we're on the watch list, is the waiver the only means to bring students on campus?
That is my understanding.
The governor was clear that third grade and up required masks and social distancing. Are you saying stable bubbles will not need to distance and wear masks?
That would be, if you had strictly a stable group of 12 and there were no others that entered into that group for 4 weeks, I would suggest that you'd only want to go that direction of not having social distancing if they were younger children, because social distancing is very protective. So I would ask why. What was the reason for saying that these groups of 12 that are older, let's say they're 10-year-olds, shouldn't social distance? Well, maybe it's because they have disabilities that make it very difficult, in which case I would think that would be an exception. But to the extent that we can social distance, it's very, very protective. And the facial coverings we know are very protective as well as having open windows for ventilation.
When do you expect the surge to decline?
It depends what we do. It depends if we, so much of it depends on if we're social distancing effectively. And we've seen that. We've seen that, the R naught, which is the measure of how the number of people one person infects. We saw when we had sheltering in place how that R naught came down. So as we open up more, that's going to make the R naught go up, which is what we're seeing right now. So the answer would be, it depends what we do locally. Right now, what I'm seeing from the evidence is we are in an escalating pattern, and I'm not seeing any evidence that that's slowing down at this time, but it takes about 2 weeks to see.
We have a number of families with internet connectivity issues. Are we able to have a few classrooms open where students can work 6 feet apart?
Again, I would have to read the governor's guidance. So again, it's not the health officer saying yes or no to that. But what I believe from what I've read in the governor's guidance is that if you have minimal operations, I mean, you're talking about, Supervisor Williams, if we're on the watch list?
Correct.
There is a way to have minimal operations So I'm assuming that minimal operations would be allowed, and this could be put under minimal operations. You know, this is new, right? This is new as of last week. So I think we have a lot of questions. And I think what can be very helpful is if we have these types of questions, to have them elevated up to the state by the health officer. I found that to be a very good way that I can be of help. So to the extent that I don't know the answer to that, but that I might be able to put protections in to say that, yes, we should allow that, that would be a good strategy. And I think that we in our rural county must have that. This has been that ability to have children who don't have internet connectivity come into school. This has been a conversation on the state calls. What if we have, you know, areas where there's not connectivity? And there's definitely been the recognition that we need to have a way for children to get that connectivity. So I would say my answer would be we should do it. And then the health officer should advocate for it being allowed to have rooms opened with social distancing, good ventilation on campus where children can come for using computers if they don't have access at home.
We have a question, weather permitting. What is the feasibility of outside education? Say a shade cover, but open sides.
Yeah, so there's a guidance coming from the state, and it was expected today. And again, guidances or orders exactly on sports and physical education. So you should be looking for that. It's probably going to be coming out at noon in a press conference. That's usually how the governor does it. Sometimes he just drops them. So do look for that from the state. I did forward it on to Supervisor Williams, and I don't have it open up in front of me. What I have is not the guidance from the governor. What I have is what the health officers often get, which is a preview of what is likely to come. And in it, you'll see that contact sports are not allowed. So it's, yes, you can have physical education with social distancing, no sports where people are watching the sport, you know. So again, contact sports, one of the outbreaks that we had in Mendocino County was propagated by contact sports. It was very dangerous. So look for that guidance coming from the state or Monday.
I think that's all the questions in chat. Would anyone like to unmute? Any questions?
Yeah, I had a question then about contact tracing and testing capacity on the waiver process. Are there any requirements for that?
We don't know details yet about the waiver process because it's brand new, but I think that's a very good question. I would anticipate that the governor is going to look at the situation in our county in terms of whether to accept or refuse the waiver request. And that contact tracing, case investigation contact tracing, is one of the indicators that they use at the state to measure the public health response. So while that I haven't seen that being specifically included, I would not be surprised that that would be how the governor might determine whether it was approved or not. And we are doing everything in Mendocino County to ramp out our case investigation contact tracing. We're using every resource that the state provides, and as we speak, we're ramping that up. So I think we are being viewed. I will tell you that the state views us very favorably in Mendocino County. They see us as have done everything that is possible to respond appropriately. And one of the ways that we get evidence of that is that we were given a very powerful and valuable testing machine for Fort Bragg for the Mendocino Coast Clinic. It was given to us by the state. It's arriving today with 300 test kits. It's called the Abbott ID Now, and we were selected to receive that. That's an acknowledgement that we're doing everything we can in Mendocino County.
More questions?
I saw a question there, it flew by me about OptumServe in the chat. OptumServe continues to be a resource that we have available in the Ukiah Valley at the fairgrounds. We continue to have that resource, and we're very grateful. That's a free resource from the state that allows us to do over 100 tests a day, 6 days a week, or 5 days a week, excuse me. So that continues to be a resource that we maximally use. There have been other counties that have gotten the OptumServe resource, but they had it taken away because they didn't maximize its use. So we've always been exceeding the expectations of the state with OptumServe. The issue with OptumServe is that those samples get sent away to the Quest lab in San Juan Capistrano, which is a national lab. And that lab is taking up to 14 days to get us back results. So that's very, very challenging, because by the time we get the results back, it's difficult to do case investigation contact tracing because it's an old result. But what we've been doing now with the new orders of mine that came out last week is requiring, when anyone comes for surveillance testing and they have symptoms or they are a close contact of a known case, we give them blanket isolation or quarantine orders. People are not supposed to come to surveillance testing under those circumstances that they're actually symptomatic or they've had close contact, and they should be in quarantine, but they do. So recognizing that reality, we've been putting people into isolation and quarantine when they come for surveillance testing. And that turns out we've been learning as being protective, because when we get these results back of a new case and it's 14 days old, we're very thankfully contacting people on numerous occasions that are already been isolated because they were given the orders when they did the testing.
Dr. Duhan, a follow-up. Is there an end date to OptumServe at this point, even if you're using it fully?
Yes, thank you. We have not been given an end date, which we're very grateful for. And we did investigate whether we'd be able to afford paying for OptumServe. And it would be, it's so expensive that really, I can't remember the amount, but it was like $20,000 a week or, oh my gosh, hold on, my battery's running low. Hold on. All right, let me plug in here. Okay, out of danger. It was exorbitant. Essentially it's $200 a test. So we couldn't afford to pay for OptumServe. So we're so grateful that we continue to have it. I think at the level of the state, again, we're recognized as a county as doing everything possible to respond to COVID. We've been doing so since January, and I think we are given resources in recognition of this. And so therefore, I think that if we have some waiver requests that come to us with the school, the community, the parents, and the labor organizations all in unity saying we want the school to be open for hybrid learning, modified learning, or within the guidance of the state, we'll be in a good position to take that up to the governor, because we are being recognized as strongly responding. But we should all recognize that I believe we will be on the watch list within weeks, whenever the data at the state catches up to us, and then I don't see us getting off of it. And that's generally what states, counties across California are finding, is they're not coming, none of our numbers are coming down anywhere in California at this time. So there's no reason to expect when we're on the watch list that we would be coming off it soon. We're hopeful that we may see some improvements later in the fall, perhaps, around Thanksgiving, but we don't know. And then we're going to start hitting flu season. We just don't know when this escalation is going to turn around. If the governor put sheltering in place again back across the state, then we would see a downturn for sure, an improvement.
Any more questions? Dr. Duhan, can you give some guidance on next steps? You talked about needing broad support from schools, from the community. If communities decide to go that way in collaboration with their schools, how will that come together?
Yeah, so as I said, we have appointed a leader in the public health department, which is Neil, to be receiving these plans. and I appreciate our supervisors Williams and Jurdy on this call. I think that I would ask that Supervisors Williams and Jurdy, together with me and Neil, come together with a process. And I will definitely be looking at these plans. I needed a single point of contact and a point person to gather them together and bring them forward. And then, as you know, Dr. Andy Corin is going to be coming on board as health officer. And what I've identified for him as the two top issues that I would like him to start with are schools and skilled nursing facilities. So even though he hasn't started in his role as health officer yet, I've asked him to start doing the research and learning around what the state is allowing, specifically around schools, so that he can, the very first thing that he will be focusing on when he comes in August will be helping with these school waiver processes and reopening plans.
If we're on the watch list, without the waiver, can students come to campus to meet with a teacher and get support?
I would think that that would be possible because it's minimal operations. We have abilities to have minimal operations. It's really the gatherings that are the concerning part.
Will there be a process for approval, or can schools begin planning for that type of interaction?
I have not put any restrictions at this time that should restrict that from happening locally in our county. So I don't see that there's any barrier to that in what the governor has stated. So I don't see a barrier to having a child come to school to one-on-one meet with a teacher, is what you're saying, or parents and the child? Is that what the question is?
I think I've heard this in various venues. I think the question is, no matter how well schools execute distance learning, it'll never be the same as in person. And having that one-on-one interaction is a way to mitigate some of what's lost through distance learning. Do schools need to work with public health to get approval on that model, or they're free today to work with students one-on-one?
I think they should look. I think schools should, and if you wish, this would be an approach. Is that any questions that came out of today, this would be a strategy that we use, is that they could be put into a list, and I will take them to county council, and we will look over the governor's guidance compare it to that list and come back with answers. So we could do this as an FAQ. This is an approach that we take with county council and myself. So what I would like to propose is that we could take these questions, like this one, very, very important question, the other one about the computers, and if we could compile them, send them through, if we could, Supervisor Williams perhaps, to me. I'll take them to county council and respond with FAQs.
A number of schools have submitted plans detailing protocols for when they reopen under the hybrid model. Will those schools be receiving feedback from county public health?
So what I would like to ask is that you take a look at the governor's new guidance and make sure that it matches what you're asking, because that's the very first thing we're going to be doing. So if in your school, I would like to ask that you validate that, because you all gave these plans before the governor came out with the guidance, as I recall. So I'd like you to take a look at them and make sure that they match the governor's guidance, which you didn't have when you wrote that. And then if you agree, if you do believe that it matches the governor's guidance, then yes, absolutely, I'll take a look at it. What I don't want to do is to look at plans that they're outdated, which is why I was continuously saying we need to wait for the governor, because I can't be less restrictive than the governor. So I don't know what would be a process for me hearing. You could just email Neil, he's the one who received them, that the plan you sent before, I mean, it would be helpful if you sent it again and just said, sending it again, we've looked at the new guidance, it matches the governor's guidance, and we want you to reply to it. Then, understanding that we're coming into the watch list, this could be the plan that we take forward with your waiver.
Would you like those plans to have an updated date and an annotation noting that they're in compliance with the governor's?
That would be very, very helpful for us to say that, yes, we looked at the new guidance, this is the new date, and it is in alignment with the governor.
Are students in one classroom still in a stable group when they have siblings in other classrooms?
They are for their schooling, so that, if they're in a stable group of 12 for 4 weeks, that is separate from their household.
Are any exemptions considered for on-campus for students in need of in special need or in special populations?
And again, I think this would be a good question to add to the list that I'll take with County Council and look for language in the governor's orders. The way I approach this is that sounds absolutely essential and important. And so then when I meet with County Council, I ask how this might be possible within the governor's order.
Students coming on campus to pick up their meals or to use Wi-Fi, as long as that's not a gathering, are we correct that it's allowed today?
I believe so. Would it be an acceptable process, Supervisor Williams, for you to perhaps curate these questions that came in through the chat and then send them to me, and then I'll take them to County Council for some FAQs?
Yeah, that works.
Okay, I'll make that.
For all listening, you're welcome to contact me, Williams T @mendocinocounty.org, and I can coalesce the questions and feedback to public health.
And I'll make that a top priority of the coming week. I'm meeting with County Council on Monday. So I will, as soon as I get them from Supervisor Williams, I'll send them on to County Council. I will meet with County Council on Monday and respond. Regarding the school reopening plans then, thank you for the suggestion to resubmit them to Neil Davis with a comment that these have been reviewed in line of the governor's new guidance and that they are still in, that they are now in compliance with that new governor's guidance.
Can we share Neil's email address?
Yeah, it's Mendocino County. Hold on. I'm looking it up. It's Davis N, like Neil, Davis N @mendocinocounty.org. DAVISN. Well, thank you to everybody. I will be available next Friday if you want to meet again. And again, I'm going to be making this a priority, top priority with skilled nursing facilities for Dr. Andy Corin. So as soon as he gets up to speed and is starting, he'll be on the calls with me as well. And I'm going to be shoulder to shoulder supporting him through to December 31st. So thank you. I hope this was helpful.
Thanks,
Bye.
everyone.